Hi everyone, thanks for visiting our site. I'm Dr. Keith Lewis, and today I'd like to talk about low testosterone, or low T. Everywhere you look right now, watch TV, you see low T commercials. Get on the internet, low T ads. Listen to the radio, low T ads. We're being bombarded with low testosterone or low T advertisements right now. And of course, we've had a lot of questions in our office, in our practice, which is a functional diagnostic medicine type practice, about low T and do I have low T? Men can have low T, women can have low T, but we hear this mostly from men. And of course, the symptoms that we all know by now after hearing all these advertisements is, lack of libido is the most common, or one of the most common symptoms, erectile dysfunction, no energy, tired all the time, loss of muscle mass, getting fat, also being irritable and moody. And after talking to a lot of the wives of a lot of the patients I have who think they have low T, I'm sure a lot of the wives feel like just about everybody they know over 50 must have low T. Well, the thing is, you may not have low T at all based on those symptoms. You may have something called high E, which is high estrogen or estrogen dominance, which no patient of mine that I've talked to has ever even heard of such a thing as that. And of course, the only way we know that is, through proper diagnostic testing. But anyway, one thing about testosterone, and I think there's been probably an overuse of testosterone without adequate testing. Testosterone levels, if elevated, can actually increase another hormone in our body called DHT. DHT elevation can cause male pattern baldness, but also can contribute or lead to increased incidence of prostate cancer. People don't know that. Again, having high E or estrogen dominance, which again, symptoms of low T, can also make men more vulnerable to having prostate cancer. And if you look at some of the disclaimers on some of these advertisements for low T, you find that, there's an increased incidence of congestive heart failure, renal failure associated with this. But probably more scary than anything else, high testosterone levels can actually, again, contribute to prostate cancer, which is something you certainly want to avoid. So, if you want to really truly understand about testosterone, do you have testosterone issues? Do you have estrogen issues, DHT issues? What really is going on in your body? It's really important, that you find out, what proper diagnostic testing that you need to have performed. And our next video, if you click to the next page, we'll explain in more detail what that testing involves. And the testing itself is relatively low cost, but at least you'll know whether or not you need testosterone replacement therapy or you don't. So, we'll see you at the next video.